Welcome to the Dental Marketing Guy Show. I'm Justin, the Dental Marketing Guy, and today it is an honor and a privilege to interview Dr. Brian Laskin. If you haven't heard of Dr. Brian Laskin, let me tell you, he is the founder of OperaDDS.com, and he's going to tell us all about how this is going to increase efficiency in your dental practice. This is a technological advancement that you really want to consider. You really want to listen to the benefits to this. We're talking improved communication. We're talking about getting you into the digital age. And, I'm not even going to try and explain the whole thing. But first of all, Dr. Laskin, how are you?
I'm doing great. Thanks for having me on the show. Appreciate it.
Excellent, excellent. Yeah, I actually don't know a whole lot about OperaDDS. I met you at the Townie meeting. I saw the booth. The little tidbits that I got from you passing by were really good stuff. I remember the Apple Watch and all that you were telling me. Maybe before we jump into all that, could you tell us kind of your background as a dentist and then what gave birth to OperaDDS?
Sure. Like you said, I'm a dentist. I practice in Minneapolis, Minnesota. And what really gave birth to OperaDDS was it came straight out of my practice. Back about 4 years ago, I bought another practice and I bought a building. And we moved in one day, moved both practices into the building that I purchased. And I took my staff down we've gone to the Chicago dental meeting every year for, oh boy, it's been about 15 years now. And we bought all the stuff for the new practice. And one of the things we were looking for was a system to replace the light box system that we had in our own practice, where the hygienist would push Doctor 1 to room 1 and the buzzer, and I frankly hated the system. And the quote I got was over $16,000 for the new practice, and so I was looking for something to replace that, and there really wasn't anything that got the job done the way that I wanted it to. So we tried a few different systems, and frankly, they were all ineffective. So I was complaining to a friend of mine who owns a marketing company in Minneapolis, and I said, I don't know why somebody hasn't made it so you can just slap an iPad on the wall and get all of the information that was discussed in the room in the same order every time. And he said, well, let's do it. And that's what started OperaDDS. And so in the few years since then, and we launched a little bit over a year ago, OperaDDS, we're really trying to aggregate all communication in the dental practice into one simple, affordable, easy-to-use dashboard. It started off, like I said, with the intra-office communication, so communicating between staff members. In particular, I think that intra-office communication is the most undervalued thing in dentistry. I feel like that coordination between the assistant or hygienist and the dentist is key to case acceptance. We can talk more about that if you want to, because that's kind of really where I love that coordinating your staff members so you're all on the same page, and they're basically teeing things up for the dentist, because in my opinion the patients don't even want to hear things from the dentist first. They want to hear it from your staff first. And so when there are issues that needs that the patient have, as long as you go through a process where you calibrate with your staff members so they see things the way you see them, it should be very easy for that hygienist or assistant to kind of say what you would recommend, and then you go in and just validate that. And again, I think key to that is getting that information before you walk in the room. We've all had the experience where we go to a physician's office and you talk to the nurse, and then the physician comes in and they ask you the exact same questions. And it's the exact opposite of showing you what good clinical care should look like. We should be on the same page with our staff members. And again, that's how OperaDDS started. We then have expanded into including HIPAA Compliance, secure email, online case collaboration, so you can be doing digital prescriptions when you refer people to the laboratory or to a specialist, so you can be on the same page there too. And then also patient recall, so two-way text messages, emails, and postcard reminders. So we're aggregating all of the communication for dental practice in one secure, easy-to-use platform where there's no software to download. You just go, and you can use it, like you said, on any device. So you can jump in wherever you want when you have a question. But I get that checklist of everything that was discussed comes through on my watch while I'm working. So I just flip my wrist and I know what was discussed in the room next door. And I can decide if I want to finish the endo that I'm working on now before I go, or that's a new patient exam, time to take a working length radiograph and get in the room next door. So that's kind of the 1 minute overview of kind of how the system, where it got started and kind of where we are today.
Now, when you talk about case acceptance, I mean, I'm always trying to bring it back to the ROI. Clearly, it sounds like this helps things run more smoothly. And I think a lot of times dentists, what appeals to dentists, I think naturally to a lot of dentists is, Howard Ferrand talks about this. Boys love their toys. They go out, buy a CBCT, go out, buy a CEREC, and it's like a fun time. Meanwhile, the front desk isn't answering the phone right. But it's just kind of interesting because I think there's a lot of dentists who like the idea that technology is going to solve their marketing problems, and a lot of times it alone does not. It helps, but alone it does not. But you have brought up a really good point in terms of ROI. Not only is this more cost effective than the solutions that you were looking at, with the light box and all that. I have no idea what all that was, but it sounds like this is a pretty cost-effective way for the office to get digital, to get efficient, and but you brought up case acceptance. Maybe we could talk a little bit about that. Do you have any examples or stories of case acceptance being increased and why?
Oh, for sure, for sure. So I'll give you my personal philosophy on case acceptance. I think that oftentimes it gets overcomplicated. I don't think that, there's a few different types of cases. I'm going to leave out the large cases, the veneer cases, large orthodontics, and complex implant cases, because I personally don't believe that those are sold. I believe that somebody has a life event, like, oh, I'm getting married, I want to fix my teeth. Because let's face it, when there's a large case, you don't have to be a dentist to know that the person has some dental issues, right? Person can look in the mirror and go, my teeth are messed up. I want to get that fixed because I'm getting married or whatever event it is. So I'm going to put those aside. I'm talking about the routine, everyday, 90% of the dental cases, maybe 95% of dental cases. Let's say a patient has a bunch of amalgams and their teeth over time should have some type of indirect restoration. I believe that case acceptance comes down to a few things. I like to say the four keys when I'm talking with. I have 6 associates in my practice, so it's a busy practice.
Oh, wow.
When I talk to them, we've been growing at a very large rate, and I think it's because of this, frankly, and that's why I developed a whole software system to support it. But there's 4 keys to case acceptance in our approach. One is you say you have the greatest hygienist or assistant in the world. So you're validating, it has to be genuine, but you have to validate the staff member that you're working with, because typically speaking, the patient likes them more than you, I think in a lot of cases. And they spent the last hour talking with them, and so you say, you know what, I like her too, and I have faith in him or her. And so you have the best hygienist in the world. I completely agree is number 2. So you can say usually you will agree if you do go through a process that a local consultant here, Bill Rossi, taught me of calibration of how you get on the same page with your staff. So she's the greatest. I completely agree. Then you say, do you have any questions? And the key to that is you're not re-explaining what's already been explained. The hygienist has just spent 40 minutes talking about this with the patient. If you come in and re-explain everything, it shows that you really don't trust your staff member and you haven't trained them to communicate the actual importance of it. And then you're also giving them the opportunity to ask questions that maybe they didn't think of or they didn't feel comfortable asking the auxiliary member. And then the 4th thing you say, ideally you say, would you like to do it today? So you're giving them the opportunity to stay and have it done today, which just giving them the option, oftentimes it's surprising to me how many people want to get dentistry done that day. And obviously that's a simple concept. She's the greatest. Completely agree. Do you have any questions? Would you like to stay to have it done today? But to set up your practice to be able to say all of those 4 things, it requires a lot of thought. It requires good communication between staff members because you do have to agree with her. You do have to think she's the greatest. Uh, Obviously answering questions is the easy part. The hard part is shutting up for most dentists, frankly. They want to spew their knowledge at the patient. And the fourth thing, do you want to stay to have it done today? You have to have extra capacity and auxiliary staff members to be able to get fit people in when they want to have work done that day. I think that's case acceptance in a nutshell, because patients can't judge our quality of care. What they
Right.
judge us on is if we look like we know what we're doing, frankly, which is having staff members that we can validate, and and having confidence. And it takes a lot of confidence to say, well, do you have any questions? Let's go do it if you want to. So that's my, it's simple in theory, but difficult in execution.
Right, right. And I think the listeners really appreciate those tips. That's an interesting philosophy. I've never heard that before. And I like that you got it into four concepts, four steps, four parts. I mean, so many people out there teaching about case acceptance and all that. It's like, here's your 482 million steps. It's like, whoa, hold on. But four steps. And so how does Opera DDS actually help with that four-step process?
Well, it's a great question. So the features we could be here all day talking about the features in the system, because I said, like, we do recall, integrated with practice management system and secure email. But my favorite feature in the entire thing is what we call the pager checklist. So the intra-office messaging piece is called pager. So it's like a, in-office paging system. And the checklist is you develop. In my office, the checklist starts off with the patient's name, then their chief complaint, their what radiographs were taken, perio, restorative, any extra things you talked about, and then some personal notes. And so that comes through, like I said, on my watch or on the iPads, on a PC or Mac, whatever screen you have, it comes through on. Uh, and so when I walk in the room, I already know what was discussed. So I can quickly look and see, let's say Jane broke number 3. Okay. When I walk in the room, I don't say, boy, what's going on here? Or could you tell me what's going on? The first thing I say is, oh my gosh, I'm so sorry you broke that tooth, Jane, right? It sounds like you may need a crown. I can get my financial arrangements, which have already been done, because we have the paging system, so we can send the message to the front desk saying Jane may need a crown, so they already get that taken care of. Abby has a room ready next door because that's already been communicated in the same page. And so when I walk in, everything's already preset to do the work that most likely needs to be done. And because we also have a checklist item called calibration, where we, particularly when we have a new staff member, where we calibrate on the number of indirect restorations that the patient may need. You can calibrate on anything if the patient needs to have ortho. And basically you go through a process with your staff members so you make sure that you see things the same way. And again, that comes through the checklist also. So when I walk in, I already have all the information. We still go through a debriefing for the patient's benefit, but that's different than the checklist message. But because we have the sophisticated but easy to use intra-office communication, that hygienist sets it up for the financial arrangements, for the assistant to get the room ready. And when I walk in, I come in with the solution. And so I don't know if I'm communicating it well here, but it's a seamless flow that may seem that it's easy to do in a different way, but it's really not. To get all those staff members sort of queued in very quickly and easily is why I developed the system.
Yeah, we had Dr. Gina Dorfman on the show the other day, and she was talking about kind of the same kind of issue where it was like, she's like, oh, your patient's ready. Well, what's the name of the patient? And nobody knows. It's on a piece of paper in the laboratory, and so how embarrassing to walk in there and be like, oh, hello, Mr. Morgan. Oh, yeah. It's like, I don't know. As a patient, you might think like, oh man, they must be really busy here. They can't remember anyone's name.
And your confidence in the quality of care plummets. Okay. I take it to another level. I take it to I don't come in knowing their name. I know what was discussed and dentists are linear thinkers for the most part. So I get it the same way every time. So it takes me about half a second looking at a checklist to know the key information. And so when I walk in, I don't say, oh, what's your name and what's going on here? I come in with a solution that's already been discussed, and the patients look at you like you're from outer space because the hygienist hasn't left, and you come in going, Abby has a room ready next door. I haven't even looked in your mouth, and I'm with 95% accuracy. I can tell you we're probably going to end up doing a crown if you want to do it today. Of course, I do an exam and validate that, but if you get on the same page with your staff, you should be able to walk in with confidence the vast majority of the time and be like, say, yeah, I completely agree, and we're ready to take care of you. You go from being looking like you don't know what you're doing to looking like you are the standard for care that should be, which, there's not a direct correlation with clinical quality, but that has to be sort of a given.
Perception. I was talking with Fred Joyle about this the other day, is, the perception of your clinical, it's the halo effect, for lack of a better term, is what's going on that I can see. Is the office clean? Is the staff organized? Do they seem to be communicating well? These are the things that tell me, like, well, if they can't get those things down, how's he supposed to get the clinical stuff down?
Yeah, and I agree with everything you just said. And of all of that, I think communication is the key that drives patient acceptance. You go in some dental practices and there's stuff flying everywhere, and it looks like it's from 1940. But if the staff members are having fun and they're communicating clearly to each other and they're on the same page, the rest of it can fade away. Not to say that those other things aren't important, but I feel strongly that communication between staff members is the key to case acceptance.
And so you said it does recall as well too. Now, how does that tie in? How's it different from the recall aspect? I mean, it's obviously different because you've integrated this intra-office communication. You're integrating this like paperless solution, and it sounds like it's really, really efficient because it's in real time. Like you said, you can shoot over to the front desk. Care credit. We're going to need care credit for this patient, or we're going to at least have to have it ready. And in the 1982 version of dentistry, which is still going on in many practices today, you got to tell the dental assistant, and then, how does that even work? Because then, I don't know. I mean, it seems like a great solution. I'd love to have the viewers, maybe try out a demo if they're interested. Do you have any options like that? Like, where can the viewers find you?
Yeah, great, thanks. You asked a lot of questions, which I'll answer quickly for you. OperaDDS.com, so OPERA, like the music. It's short for operatory too. OperaDDS.com. There's a 14-day free trial, so people can sign up and start using it for free. After that, you asked what makes us different than the other recall systems, and I think that's a great question because there are a lot of. I think it's kind of a crowded space, frankly. There's lots of recall systems.
Yeah.
What we've done is we've stripped it down. You're not going to have a dashboard that shows you how much money you've saved, that the numbers are just kind of really pulled out of thin air. We've got it. It's a very simple, easy to use dashboard. Again, it's in the same spot where you're getting your intra-office communication, your secure email, and your digital prescriptions on there with your laboratories and specialists. The other thing is that we started, as I'm a dentist, right? And so I made this for my practice first, primarily. And so it grew from the inside out. And what that means is that we started off with secure email as a key part of it, because I thought that was a missing platform, was a good, easy to use, secure email. And so one of the biggest differences that we have from other recall systems is we started off with a HIPAA compliant patient portal before we even did recall. So the patients actually have their own individual login that they can use for whatever healthcare providers they want. And so you can communicate effectively and securely with patients. If a patient requests their x-rays, for example, you guys can communicate back and forth very easily within OperaDDS. And that's sort of a unique feature because everybody else sort of had this. They were doing text messages and non-secure emails, and then they did like, well, boy, there's this thing called HIPAA. We've got to figure out a way to communicate securely. Whereas we started off with that first. That's kind of our core competency, and then we just basically added on the easy stuff, which was text messages and non-secure emails and postcard reminders. And we made it in a way it's a nice, clean interface. Works on any device. You can do it from your phone. Just I think our coding's kind of top of the line for sure.
So HIPAA compliant, and here's the thing about HIPAA is, I mean, I'm probably about to implement a live chat system. I'm working with some HIPAA compliance people. It's like it's a zoo trying to figure out HIPAA compliance, and that's when you're working with the top experts. I think a lot of dentists, I'm just putting myself in their shoes. I think a lot of dentists look at HIPAA and they say like, well, how much is it really about the letter of the law? Is it really the spirit of the law? And what do I really need to do? Like, what's the tipping point? It seems like it's this huge gray area, and if you ever get audited, it's a nightmare. They like have you by the balls, and so I think it's definitely very important if you're a practice that could be eligible for one of those $10 million fines, that you want to have your ducks in a row. But I think a lot of the viewers who would say, I don't know. I mean, I try to do what I can to be HIPAA compliant, but you can never be perfect. Why even try? And then what? I know you're a dentist, like you said, so you probably have a little bit better idea, and I'm sure you're working with some top experts in the HIPAA field. But how do you really know what is HIPAA compliant and what's not HIPAA compliant?
Well, I've for lack of better terms, I've really become a HIPAA expert because I've been doing this for several years now, and beyond that, I've really gotten it. It sounds silly. It's like being interested in taxes, but I'm really interested in regulations because I think that's a huge problem, how regulations enter the marketplace. And I've learned a lot more about it, and HIPAA in particular, I know a lot about because we have a HIPAA compliant solution. I think there's a lot of misinformation out there. I think the reason why it seems so daunting is because people aren't distilling it down to what you really need to know, like you said. And to simplify it, what I like to say is that HIPAA is not much different than other regulations like OSHA. If you said, can you be OSHA compliant? Well, that's kind of hard to do, but there's some basic things you have to take care of, right? You should be sterilizing your instruments, right? You'd be a moron to not wear gloves. There's infection control, even though sometimes it's taken to what we view as too far or it seems ridiculous. It's hard to say that we shouldn't be practicing infection control on some level. The same thing is true with patients' privacy. Okay, when you're sending email, it should be secure. Your medical information, your dental information is no different than your financial information. And if your bank was sending you something that could be intercepted easily, that's not encrypted or not stored in it safely, that's not right. There's also been, I think, like you've mentioned, these fines. The fines are real, but I think even more than the fines is that companies are using fear tactics to try to make people compliant. And where it may be effective, it doesn't have the effect of people going, yeah, I really want to do this, And so what I've tried to do, OperaDDS, as far as I know, is the only sort of has a free HIPAA compliant email functionality. And we've been, we have thousands of offices that have joined on, basically because of our HIPAA compliant email, and we keep adding more features. Like our recall system is relatively new. We just launched in February, and it's exploding. But the HIPAA compliant email piece is recognized. People recognize that that's a necessity. To go back to kind of your the base of the question, what do people need to do to be HIPAA compliant? I would go back kind of like OSHA. You need to appoint somebody who's your HIPAA officer in your office. You need to come up with policies and procedures, just like you have radiographic policies and procedures. And the key thing is that you have to make sure that those procedures reflect what you really do. So you have to have annual training on your procedures and make sure that you actually follow them. One of the way that people get the biggest fines is if they have a policy in place and they don't actually do it. That's one of the big things they look at. And then there's the tools like OperaDDS that allow you to be compliant. If you're sending an X-ray to a patient and you send it through Gmail, there's metadata in there that includes the patient's information. So even if you don't put a patient's name on there, that's illegal because it's easy to intercept. So I view OperaDDS as kind of like the gloves to OSHA. It's a tool that you can use to help you be compliant. There's we don't do HIPAA training, although pretty soon it looks like we're making a deal where all the OperaDDS users are going to have free HIPAA compliant training through an online HR company, which we're excited about. But we're not in the business of the policies and procedures or training or obviously you have to appoint your own officer. But there's lots of good companies that do that.
Excellent, excellent. And okay, so as we wrap it up, let's talk about, maybe we could end with, I like the 4 keys to case acceptance. I can see how OperaDDS would help with this. It sounds like it's almost like an onion, OperaDDS, where you peel it away and there's you got the recall and then you got the intraoral, the intra-office. I guess it could be intraoral communication, and just it sounds like there's a lot of levels to this. So that's pretty cool. Could we just, if our viewers remember one thing about this interview, I'd like them to remember about those 4 steps to case acceptance. Could you go over those one more time real quick?
Of course, and I think you're right. I think that is kind of the meat of what we discussed about. And primarily, I think it's first of all, before the 4, you have to be on the same page with your staff, and they have to be communicating to you in a way that you get complete information before you walk in the room, so that you can execute on the 4 things, which are you have the greatest assistant or hygienist in the world. I completely agree. Do you have any questions? Would you like to have it done today? Those are the 4.
Yeah, and it's great, because that last one, I know, I'm not any sales guru, but I know that sometimes if you just ask someone, do you want it? like cash or credit, and sometimes that question is all they really need, because we all have this kind of like internal buying resistance, and in dentistry it is extremely high because many people do not value dentistry as much as some people. And when you're able to sometimes you just want to make it, sales I've heard described is the ability to allow someone the permission to buy. Like just give them permission, let them feel like they're allowed to do it, and then they do it. And so often I think dentists get it in their head that I mean, like, well, you go ahead, you can think about it, and that's fine. You shouldn't pressure people. You should let people, like, oh yeah, go home, think about it, talk to your wife, for sure. But at the same time, I think this is huge, is allow people the permission to buy. There's nothing, it's not a dirty word. I mean, sales in the dental industry, everyone acts like it's a dirty word, but your business is dead without revenue. So you can have the greatest clinical skills in the world, but if you don't allow people permission to accept treatment with a simple question like that, like, would you like to do it today? Well, no, not today, but maybe I'm getting my tax return in 3 months. Let's do it then. Okay, cool. Could we schedule you for that? Like, you just give people permission to take care of their health. So anyways, I'm going on a rant here, but I really like that 4th tip. I like that a lot, and I think it's really underrated in the dental community.
I agree, and I appreciate everything you said just there. And being a dentist, I had a big aversion to the word sales for a while, and I think a lot of dentists do, because it sounds like you're being disingenuous, like you're trying to push somebody into doing something. And like you said, the problem is that we don't have. I mean, no dentist has to get people to do things that they don't need to do, because there's so much real work out there, in my opinion, that people need. What we're really trying to do is to get people to do what's in their own best interest, because they don't want to, or they don't see the value in it. Which, like, when we live in a country where half the people don't see a dentist regularly, obviously we have some work to do to impart the value of what we do on other people. People don't have problems spending money on cell phones or trips or whatever, and it's our job, so that to get people to, like you said, to value their oral health, because at least as much as, if we think it's in their own best interest. I mean, every dentist has had that case where you're trying to talk to somebody who has a large cavity, deep caries, and is going to be endo, and you're banging your head against the wall trying to get this patient to realize, if you don't do something, you're going to lose the tooth, or it's going to need to have endo. And we don't understand why is the patient not understanding what we're getting at? And to a smaller degree, we do that every day. And so being able to communicate to patients in a way that allows them to see this is in your own best interest is really what it's about. And that is sales, whether or not you call it that. If you call it treatment plan acceptance, case acceptance, whatever it is, it's really just getting people to value what we do. Because if we don't value what we do, there's no reason why patients should, right?
Right. Yeah, it's funny. I was at the CDA Anaheim a couple weeks ago, and I was talking with a really reputable consulting firm, and they were very cool, and they're going to come on the show. And they were telling me about what they do to help offices, and they used a lot of words, team building, and helping present treatment plans, treatment planning, case acceptance, da 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 da. And it's funny, and I knew I would get this reaction, but I did it anyways. I said, oh, cool, so kind of like sales training, and they went like deer in headlights. They were like, well, they're like, well, like we help them with the case acceptance and all these buzzwords, but they couldn't say sales. And anyways, I just think it's so funny that that's a 4-letter word in the dental industry. But maybe those days are going to be here soon, where dentists can say the word sales and not feel sleazy about it.
Yeah, I mean, you certainly don't need to, because I think sales does have the sort of the connotation of getting people to do something that's not in their best interest. And so it doesn't really matter if you call it case acceptance or sales, in my opinion. It's how you use the tools, right?
Right.
Whether you're using it in a way that's for people's greater good or not, is what it boils down to. It doesn't, the things we talked about today. If you're on the same page with your hygienist, really, it's what type of treatment you're discussing. It doesn't matter if you love doing pin retained MODBL, amalgams, or you're doing a cosmetic CEREC. As long as you and your staff member are on the same page, and you're just presenting whatever treatment you think is best to the patient in a way that they actually are listening and not glazing over as you talk about surface numbers or tooth numbers. I think in dentistry, we need to simplify things for patients a lot more than we do, which again, doing things in a simple way requires a lot of thought on the front end. And that's kind of what I've tried to take a lot of that out of the equation with OperaDDS. You're right. There's a lot of levels to the onion, because we're the only software platform that is doing things this way. I'm not looking at recall as a way just to sell dentists on marketing snake oil, basically. I'm looking at it as an effective way to create relationships with your patients, and to fulfill our requirement for security, and then also bringing it back into the office, so that we're not just communicating with patients. You've got your staff, you've got your patients, you've got your colleagues all in one place. It's a simple idea, but it requires a lot of levels to the onion, like you said.
Yeah. Yeah, excellent, excellent. All right, well, we're out of time, but man, it's been really educational. I like the 4 tips. This is good stuff. I mean, if you want to get your office more efficient, get that. I think the intra-office communication is really this is where things are going. And if you've followed it all, we had Fred Joyle on the show the other day, and if we talked all about how technology is the way of the future, you got to get efficient. And that's the only way you're going to be able to compete in 10, 20 years as a dentist, because corporate dentistry, they got it down. They're coming to your town, and they're coming with all these types of efficient systems. So the sooner you can get on board with technology, the sooner you can maintain your relevance. So if you have any questions, feel free to reach out to me. If you have questions for Dr. Laskin, if you'd like to check out OperaDDS.com, sounds like he's got a great deal for you, 14 days free trial. And yeah, so just feel free to reach out. You can leave comments below, and just let us know what you're thinking. If you've got some ideas of how maybe you want to see OperaDDS improve, pitch it in. If you just want to say congrats, thank you for doing what you did, maybe tell your story of how OperaDDS helped you. We'd love to hear all about it. So thank you once again to my guest of honor, Dr. Laskin.
Thank you very much. Thanks again for having me. Appreciate it.
Excellent, excellent. And thank you for watching the Dental Marketing Guy show.